Victoria is the only state in Australia where couples wanting IVF treatment must first have police and child protection checks. One same-sex couple failed those checks and was refused treatment, but then successfully overturned the decision in court. Despite their win, the two women say it's now too late for them to have children. Kirsten Vaness reports.
This is a big mistake. This has altered our lives, you know. We had planned to have a child and maybe a second child and have a great life together. And now we have nothing, just us and our 3 dogs. What's that? Nothing.
Lindsay Rylett and her partner Sarah have been together for 7 years. And for a long time they've wanted to start a family.
We did try to have a child independently of IVF. IVF was not our first choice. That was not successful, and IVF was our only solution.
The plan was for Sarah, who is now 45, to have the baby using her egg and donor sperm. The couple began the process at the start of 2010, but it was bad timing. New laws had just come into effect requiring patients and their partners to get police and child protection order checks. Sarah passed the checks, but her partner didn't.
I was in a relationship with a lady who had 2 children, and she had put them in respite and she didn't collect them, so they said that I had children removed from my care, which how can I when they're not my children? You know, I had no rights on these children.
A police check also brought up a criminal past, mainly in the 1990s. Lindsay Rylett says she got involved in drugs and was convicted of assault and the armed robbery of a service station.
I wish it never happened, I really do. But I can't take it back.
And why did you do it?
Drugs. More for my partner than me.
She served her time in prison more than a decade ago.
It's of the past. She's recognised that, you know, she wasn't in a good place at that time. She made obviously some very poor choices.
I'm ashamed of what I've done. Totally. If I could take it back, I would, but I can't.
The Department of Human Services says in child protection cases, a person is viewed as a carer if they're in a long-term relationship, regardless of their legal status. The patient review panel ruled against allowing Sarah and Lindsay to have a child.
They had every opportunity to focus on interest in terms of raising a child, you know, what our living situation is or what we wished for the child's future, that sort of thing. There was not one question on anything like that about the child's welfare.
The couple challenged the decision at the Victorian Civil and Administrative Tribunal. VCAT overturned the panel's ruling, finding the crimes in Lindsay's past were not considered offences which would bar someone from having IVF treatment. The court also found Lindsay Rylett had no custody or guardianship over her former partner's children. They could finally start IVF, but it was too late.
After we got approval and the long gap whilst we were, you know, going through the fight, things had changed, and I'm not responding to the medication or the treatment, and it now turns out that I'm not producing eggs anymore, and I can't have a biological child any longer.
It's these delays that has prompted women's law advocates to step in. Lawyer JACINTA LEWIN required IVF to preserve her eggs before treatment for a rare blood cancer.
We were very fortunate to have a treater who rushed me through treatment just before the laws came into effect, but we were still provided with all the material, and I remember feeling somewhat outraged, anxious and very, very stressed out by this additional burden placed on me.
She's currently gathering other women's experiences of the laws to write a submission to the state government.
I understand that it came in to protect the rights of children, and I don't think any woman would disagree with that being a really important right to protect, but with having clear exemptions or having the provisions written in a way that was less onerous, you would take away all this unnecessary stress, anxiety and potential delay and discrimination.
Those in the IVF industry say the laws unfairly single out infertile couples.
Perhaps if you were being fair, you'd in actual fact do a police check on all couples before they take their baby home from hospital.
Sandra DILL from the national infertility group Access Australia says Victoria is the only state in the country to require police and child protection checks. And she believes the reason they were brought in was to appease Conservative members of the previous Labor government.
Access was told that in order for the Attorney-General to get it through, Cabinet needed to put in place a requirement for child protection order checks and a police check. And the only difference in this legislation to the previous one was that gay and lesbian couples were to be given access to IVF treatment. So you're left to draw your own conclusions about that.
And she has a message for the current government.
A fair go.
Without delay, remove that discriminatory practice so that a group of people who have a medical condition of infertility or who have cancer and need to have access to quick treatment to preserve their embryos or eggs can have access to that without this nonsense of applying or having to apply for a police check.
But it doesn't look like anything's about to change anytime soon. The opposition won't comment on decisions made in Cabinet when it was in government, and the current government has also refused to answer questions on the matter.
I suppose the argument against it is quite simplistic in the media. Do you want paedophiles to help paedophiles have children? It's very hard to argue against that. But what I suppose I would say is, where is the evidence from the other states that this is a problem?
But Lindsay Rylett and her partner Sarah have a $50,000 legal debt. The government has offered them $31,000 to help cover costs, on the proviso no further legal action is taken.
They just want us to disappear, and we're not going to disappear. We will be here till the end, and we will fight them all the way until we get the right, the legal bills paid for.
The Department of Health won't say how many couples have been refused IVF treatment by the patient review panel.
I understand that it's a closed session and that you're not necessarily entitled to legal representation. And if you were going before a panel over a minor violent offence and that had the potential to prevent you and your partner from having children, I would hope that at least that tribunal inquiry could be conducted in a transparent manner where there was clear decision making that was open to public scrutiny.
Sarah and Lindsay Rylett say they've told their story in the hope things will change.
No one should go through this, and I hope that if it has happened to someone else, they come out and be heard, tell their story, so this can stop happening in the future to other people.
They still dream about having a child, but are starting to come to terms with their reality.
I want my own child. I want a child together. We've run out of time. They stole time from us.
We didn't have much time, and now we have no time.